I want to continue the conversation now on healthcare stocks that you may consider for your portfolio. We're joined by Les Funtleyder. Les is an analyst for Miller Tabak. He is also the author of the book Healthcare Investing, and he joins us now from San Diego. Les, great to have you with us. Before you get to the specifics of healthcare and healthcare investing, how did you get into this business? Because you started out actually working for healthcare companies.
Right. Well, I've always had an interest in stocks, and this is going back 15 years, and I thought this was a great way to apply my industry experience, and it's been terrific so far, and it's never a dull day in healthcare equities.
All right, well, let's break down some of the equity industries within healthcare, right? Well, you heard what Shannon was talking about in terms of the health insurance companies, the HMOs. What is the outlook for those stocks?
Sure, and let me just add one thing that I was thrilled to hear Shannon say, that there's tremendous volatility in the sector, and as you know, we started a healthcare fund in October because we anticipate a lot of both up and down as we move forward over the next couple of years. So let's talk about the insurers. Basically, for the 2 years running up into last year, until last year's election, I think most investors had assumed that the government would do its best to put the health insurance industry out of business and compress valuations to almost breakup values, really. And what happened was we had a Republican Congress which kind of halted any concerns about that. And the underlying business conditions at these insurers were actually quite good. So without the exogenous events, the health insurance stocks did quite well and continue to do quite well.
And do you think that this is an area that investors ought to be putting more money into?
Yeah, although they've had a big run, our model suggests that we've probably got another year and a half or two to go of upside, because it actually has more to do with medical cost trends than political issues. And medical cost trends, although you wouldn't know it by reading the newspapers, have actually been subdued. And so insurers are actually able to make quite a bit of money when health cost trends are not growing at outrageous levels.
Well, Les, are those savings being passed along either to the consumer or to government programs?
They're more likely to be passed along to the corporations who generally pay for insurance, rather than directly to consumers. The one note on the individual side, if you are an individual and not employed or employed yourself and go buy insurance, there are now regulations related to the health reform bill that limit the amount of profit insurers can make on that plan.
Les, the United States pays more per capita for health care than any other nation, and yet we don't seem to live that much longer than other nations. Why is that, do you think?
Well, a lot of it has to do with the prices we pay as opposed to the volume, because as it turns out, places like South Korea and Taiwan, I was actually recently in Asia investigating some of this, they go to the doctor more than we do. We just pay higher prices for almost everything, and that includes drugs and devices and services. We're going to
continue this. You described how in the United States we pay more for our health care than any other nation. Now, that has got to bring into the conversation Medicare and Medicaid. What role are they going to play in the future if indeed we're going to stay solvent?
Well, that is literally a multi-trillion-dollar question. I think it's pretty clear that the rate of growth in Medicare has to slow, or we need to increase the amount of revenue we put into the system, or both, probably both. I think it's well known that these entitlement programs are not sustainable given current conditions. So probably we wind up with some forms of cost controls, and I would imagine, and I can say this because I'm not a politician, that at some point taxes are going to have to go up as well.
All right, so taxes, in your description, they go up because the systems need new revenue. And what about the proposals to privatize certain portions of Medicare, and indeed also make it so that you'd have a reimbursement from the federal government to buy individual private health insurance?
To be fair, I find the chances of that highly unlikely. I think Medicare is a very popular program, as is. Although administered by some insurers, it's actually a little bit better. But in general, I don't think the voucher system will succeed. It is a bit of an old, and that, along with block grants, seem like a bit from the Wayback Machine, from the Reagan era. I'm not sure it's workable in that, healthcare costs are going to grow faster than the amount of adjustments they can make. The other problem with the voucher system, and again, it goes to the problem of market failure. That would be fine if healthcare was a market and the way we understand it, but it's really not. There are a lot of market failures with healthcare. For example, there's a complete lack of transparency. We don't know how much things cost, and we don't know the quality of the services or the products we're getting. So how anyone can make an informed decision given vouchers seems like a dangerous combination to me.
Les, is there any other system put in place by any other country in the world that would serve as a better model for the sort of payment for health care as well as the delivery?
Well, every country in the world is grappling with the cost issue. There are some, say the Danish system or the Swiss system, where there are private insurers, but it's sponsored by the government, that may be a little bit more effective than ours. However, they're grappling with cost controls. And I just add, America, in terms of healthcare development, is probably the most innovative place in the world. I mean, we come up with all of the new stuff, or much of the new stuff. And so there is an element of free riding going on internationally.
So in other words, we've got the deep pockets here in the United States. If we've got the deep pockets, then of course this is where the companies that create these innovations are going to be looking to market their services.
That's correct. So things happen here, and they happen other places later. So maybe we should be paying less, and other places should be paying more. I mean, in emerging markets like China and India, they're grappling with how to insure 1 billion people each, and nobody's come up with a good solution. So while the statistics look pretty bad on a relative basis, there are some reasons for it. And I'm not sure that a European solution or an Asian solution could work in the U.S. I think we need a uniquely American solution, if you will, that involves some private and some public involvement. I'm not sure one way or the other is going to be successful here.
Well, Les, you're joining us from San Diego. What about a model that seems to at least be popular in certain circles in California, Kaiser Permanente? Is that a model to look at for the nation?
Yeah, it's a good model on a regional basis. However, the Kaiser model involves basically owning physician practices and having facilities. It's hard to scale something like that nationally because you can't put a facility everywhere. And so while that sort of model probably works fairly well in on a regional basis, it would be hard to do that nationally. If you have a one employer, like a large employer, who had multiple places, multiple sites of business, it'd be difficult for them to, go one-stop shop.
Les, do you have any optimism that we're going to be able to tackle at least the deficit as it relates to these healthcare spending issues?
Well, there are some reasonable proposals sort of down the middle, like increasing transparency in terms of cost and outcomes, and then focusing on the 5% of the population that costs 49% of the total costs. So there are proposals out there that will not result in so much pain, but be effective. But the problem is, oftentimes they get demagogued away by politicians.
We got to leave it there. Les Funtleyder joining us on Miller from Miller Tabak.